is traditionally thought of as a elderly disease, but what we're seeing now is it much more prevalent in a younger population. And what we believe is with their use of apps and screen time, that actually when you're concentrating very hard on something, you blink less often, and also you only do a partial blink. And that in combination is doing damage to their eyes, and unfortunately that damage also then changes the amount and the quantity of the tears that they produce, which will cause further damage. Quite often it's treated as an annoyance rather than a proper disease, and of course our secondary care in hospitals just don't have the time to deal with it. So what we're trying to do is make it much more accessible to the general public, and you'll have heard recently there's been a change within the National Health Service, for example, where they're trying to get people to self-manage conditions such as dry eye. So actually by giving people more information about their condition, we should be able to help them, but also stop some of the burden on secondary care.
Whenever you feel the need to blink, that would be the time when you need to stop.
So the app we've developed asks some basic questions about the symptoms you get. That's very well validated and developed many years ago. But what it adds to that is a test where you get the patient to blink, hold their eyes open and stare at the screen, and just record how long it takes for them to feel discomfort. And we repeat that 3 times, and some research that we've launched just today shows how well that correlates to our very complex clinical testing that we can do to prove the diagnosis of dry eye. There is that level of irony using technology to perhaps fix something that the technology is creating, but actually in some ways that's good. If you can't beat them, join them. So that's what we're doing to try and give people more access to empower them to treat their own dry eye.